Today we're going to discuss surgery and surgical incisions. This information can be found in chapters 39 and 40 of your textbook. Surgeries are done in hospitals or ambulatory surgery centers. Hospital patients are typically admitted 1 to 2 days before surgery or the morning of surgery, depending on their health conditions. Some patients have surgery after receiving emergency room care. These patients may stay for 1 or more days after their surgery. Ambulatory surgery centers are designed and equipped for certain surgical, diagnostic, or preventative procedures. Eye surgeries, colonoscopies, and pain management procedures are often done at ambulatory surgery centers. These patients go home in less than 23 hours. So an elective surgery is a surgery that is done by choice to improve life or well-being. So for example, a hip replacement or a rhinoplasty, those are examples of elective surgery. An urgent surgery is a surgery that's needed for health, but it can be delayed for a few days. So certain types of surgeries to address cancer are considered urgent surgery. An emergency surgery is one that's done at once to save an individual's life or the function of a limb or an organ. So examples of situations requiring emergency surgeries are vehicle crashes, stabbings, and bullet wounds. Surgery can cause many fears and concerns in the patient. So they might be afraid of the anesthesia, of complications, disability, dying, pain, prolonged recovery, concerns for caring for children or other family members. They might be worried about hospital bills or their pets. So mental preparation is really important. So what the CNA can do is they can listen as the patient expresses their concerns. They should refer any questions to the nurse. The CNA should use verbal and nonverbal communication skills. The CNA should report any signs of fear or anxiety to the nurse. And they should also report a request to see a member of the clergy. The CNA should never tell patients results of tests or any different of their diagnosis. The preoperative period may be many days or a few minutes. If time allows, the person is prepared mentally and physically for anesthesia and surgery. The goal of that is to prevent complications before, during, and after surgery. The nurse provides patient information. The nurse explains what to expect before, during, and after surgery. There may be special tests that are ordered in the preoperative period. So the doctor will evaluate the person's health status. The physician may order a chest x-ray. They might order blood work, like a CBC. They might order a urinalysis, or they might order an EKG, which looks at the electrical activity of the heart. The tests that are ordered depend on the person's condition and then the surgery that they are having. If there's expected blood loss, the person's blood is tested for blood type and compatible blood from a blood donor. This is called a type and cross match or a type and screen. The test results must be in the medical record before surgery. The person is going to be NPO before surgery. These measures reduce the risk of vomiting and aspiration during surgery. An NPO sign will be placed in the person's room, and then you remove any water or any food that is within the patient's reach. Bowel surgeries and procedures may require bowel prep, which just means cleansing the bowel of feces. Feces contain microbes. When the intestines is opened, feces can spill into the sterile abdominal cavity, causing a serious infection. The bowel prep helps prevent contamination. The person will void before the nurse gives the pre-op medications. Catheters are commonly inserted in the OR. Personal care before surgery might involve a complete bath or shower. Makeup, nail polish, and non-natural nails will be removed. Hairpins, clips, and wigs will be removed. Dentures will be removed, and then adaptive equipment such as hearing aids and glasses will be removed. The person's informed consent is needed for surgery. The patient and family are told about the need for the surgery risks and possible complications, other treatment options. the risks from not having the surgery, who will do the surgery, when the surgery will be done, and approximately how long it will take, and then the expected length of recovery. The CNA is not responsible for obtaining consent. Before the surgery, the surgeon will also mark the surgical site. The patient is asked to confirm the site. Marking the site just prevents surgery on the wrong part. This is a sample preoperative checklist. When I worked in the hospital, night shift nurses were responsible for making sure that everything on the checklist was completed so that the patient could go to surgery the next day. So preoperative medications help the person relax and feel drowsy. They are used to reduce respiratory secretions and to prevent aspiration. And there are also medications that are given to prevent nausea and vomiting. So after these medications are given, the person might feel sleepy and lightheaded. The person is not allowed to get out of bed. The person should void before the medications are given, and then the bed rails should be raised after they are given, just for safety. Skin prep reduces the risk of surgical site infections. A surgical site infection is an infection that occurs after surgery in the body part where the surgery took place. So to prevent them, the area around where the surgery will occur is cleaned with an antiseptic. An antiseptic is a chemical applied to the skin to prevent the growth and reproduction of microbes. So the incision and then a large area around it are prepped, and the prep is done right before surgery. Hair is not removed from the surgical site unless it will interfere with surgery. If the surgeon orders hair removal, it is done before the antiseptic is applied. Electric clippers, like the ones pictured on the slide, are used for hair removal. Shaving with a razor can cause small cuts in the skin, which increase the risk of surgical site infection. And this is a picture here. It's called ChloraPrep. And what you do is you press against like the handle button and push it in, and it pops. And once it pops, the medication comes out of the orange sponge, and that can be used to prep the body before surgery. These are some pictures of the area that would be prepped. So in picture A, you would prep those areas if the patient was having an abdominal surgery. Picture B, you would prep all of those areas for open heart surgery. And picture C is what would be prepped for a cervical spine surgery. Sedation is a state of quiet, calmness, or sleep produced by a drug. Anesthesia is the loss of all sensation, especially pain. So general anesthesia is a treatment with certain drugs that produce a deep sleep in absence of all sensations, especially pain. Regional anesthesia is the loss of sensation produced by a drug in a large area. So the person is awake, and then the drug is injected into that body part. Local anesthesia is the loss of sensation produced by a drug in a small area. A drug is injected at the site. So local anesthesia, an example of that is when you go to the dentist and you have the lidocaine injected for a cavity. So you don't feel the pain in just that one area. An anesthesiologist is a doctor specializing in giving sedation and anesthetics. An anesthetist is an RN with advanced study in sedation and anesthetics. So that's a CRNA. So for post-operative care, patients are NPO until they're stable. Vital signs are taken every 15 minutes until the person is stable. And then the person is turned and repositioned every 2 hours to prevent pressure injuries. And then early ambulation is recommended when the patient is able to. So the PACU, P-A-C-U, is the post-anesthesia care unit. So after surgery, the patient is taken to the PACU to begin post-surgical care. Recovery from sedation or anesthesia takes about 1 to 2 hours. Vital signs are measured and observations are made often. The person is transported to his or her room when vitals are stable, respiratory function is good, and the person can call for assistance. PACU staff transport the person, and a unit nurse meets them in the person's room. The CNA should assist as needed for the stretcher to bed transfer. Once in the room, the person is positioned for comfort and to prevent complications. There may be position restrictions after some surgeries. The person is usually positioned to promote comfort for easy and comfortable breathing, to prevent stress on the incision, and to prevent aspiration. When supine, the head of bed is usually raised slightly. So to prevent complications after surgery, coughing and deep breathing exercises are recommended. Patients generally have an incentive spirometer. So coughing and deep breathing exercises help prevent respiratory complications, including postoperative pneumonia. Incentive spirometry does that as well. And that is when they blow into the machine and the ball blows up and they try to hold the air into their lungs, and it just expands the lungs. Circulation in the leg must be stimulated to prevent DVT and PE. A DVT is a deep venous thrombosis, and a PE is a pulmonary embolism. If the blood flow is sluggish, blood clots may form. A blood clot is called a thrombus. Blood clots can form in the deep veins and the lower legs or thighs, so that's a DVT. Signs or symptoms are swollen area of the leg, pain or tenderness of the leg, and red, painful, or discolored skin. A blood clot can break loose and travel through the bloodstream. It then becomes an embolus. An embolus is a blood clot that travels through the vascular system until it lodges in a blood vessel. So a pulmonary embolism is a blood clot that broke loose and it travels to the lungs. To prevent DVTs and PEs, leg exercises, ambulation as soon as possible, elastic stockings, and sequential compression devices are recommended. So the picture on the right of the slide shows a sequential compression device. The sleeves go around the patient's leg, and there's tubing that connects to the machine, and you turn the machine on and it pumps air in and out to help promote circulation. So this here is a picture of a blood clot in picture A, and then an embolus in picture B. So in picture A, the blood clot is attached to the wall of the vein. The arrows are showing the direction of blood flow. In picture B, part of the thrombus breaks off and becomes an embolus. The embolus travels through the vascular system until it lodges in a distant vessel. These pictures show leg exercises to stimulate circulation. So in picture A, the knee is flexed and then extended. In picture B, the leg is raised and lowered. Leg exercise promote venous blood flow and help prevent thrombi. The nurse will tell the CNA when to perform the exercises. Typically, they're done every 1 to 2 hours while the patients are awake, and they're typically done 3 to 5 times. This picture here is an elastic stocking. They put pressure on the veins, and that promotes venous blood return to the heart. The stockings help prevent blood clots in leg veins. Elastic bandages have the same purposes as elastic stockings. They provide support and reduce swelling from injuries. Another use is to hold dressings in place. Elastic bandages can be applied to the arms and the legs. And then this here shows the sequential compression device. You'll hear it called SCDs in the hospital. It's a sleeve that straps around the leg. It's made of cloth or plastic and secured in place with Velcro. A pump inflates the device with air. This promotes venous blood flow to the heart by causing pressure on the veins. Then the pump deflates the device. The SCDs are applied to both legs. After one side deflates, the other inflates. So let's review different types of wounds. A wound is a break in the skin or mucous membrane. Wounds commonly result from surgery, trauma, unrelieved pressure or friction, decreased blood flow through the arteries or veins, or nerve damage. So the left picture is an abrasion, which is a partial thickness wound by the scraping away or rubbing of the skin. The right picture shows excoriation, which is the loss of the epidermis, the top skin layer, caused by scratching or when the skin rubs against skin, clothing, or other material. The picture on the left is a laceration, which is an open wound with torn tissues and jagged edges. The right upper picture is a penetrating wound, which is an open wound that breaks the skin and enters a body area, organ, or cavity. And then on the right lower is a puncture wound, which is an open wound made by a sharp object, like a knife, a nail, metal, wood, or glass. An incision is a cut produced surgically by a sharp instrument. It creates an opening into an organ or a body space. So let's talk about wound healing. The healing process has 3 phases. So phase 1 typically lasts about 3 days. That's when the bleeding stops and a scab forms. During this phase, the signs and symptoms of inflammation appear. Those include redness, swelling, heat or warmth and pain, and loss of function may occur. Phase 2 is typically days 3 through 21, and this is when the cells multiply to repair the wound. So some wounds don't heal in a timely manner. A chronic wound is one that does not heal easily and within about 3 months. Finally, we have phase 3, which is 21 days to 2 years, and this is when the scar gains strength and the red raised scar becomes thin and pale. There are a couple different types of wound healing. When wounds heal by first or primary intention, the wound is closed. When wounds heal from secondary intention, the wound heals from the bottom up. And then third intention is when the wound is left open and closed at a later time. There's some pictures on this slide. So in picture A, that's the wound healing by primary intention. So there's an incision, it's closed, and you have a fine scar. In picture B, that's wound healing by secondary intention. So you have an irregular large wound with a blood clot, tissue fills the wound, and then you have a large scar. And then on this picture, you have third intention. So you might have a contaminated wound. They wouldn't want to close that because all the bacteria and germs would be kept inside the skin. So they leave it open. And then tissue will begin to fill the wound. And then as the infection clears, the doctor will close it later. So some different complications of wound healing. So there are a lot of factors that affect healing and the risk for complications. They include wound type, age of the patient, patient's health, nutritional status, and lifestyle. Age, smoking, circulatory disease, and diabetes affect circulation, which also affect wound healing. So when patients have wounds, they need good nutrition. Protein is needed for tissue growth and repair. So a hemorrhage is the excessive loss of blood in a short time. Shock will result when the tissues and organs do not get enough blood. So an internal hemorrhage occurs when there's bleeding inside tissues and body cavities. A hematoma is swelling that contains blood. The area is swollen and reddish blue in color. Shock, vomiting blood, coughing up blood, and loss of consciousness signal internal hemorrhage. An external hemorrhage occurs when there is bleeding outside the body. Common signs of an external hemorrhage are bloody drainage and dressings that are soaked with blood. And an infection is when contamination occurs either during or after the injury or surgery. An infected wound will appear inflamed and will have drainage. The wound is painful and tender, and the person may have a fever. Dehiscence is the separation of wound layers. It may involve the skin layer or the underlying tissues. Abdominal wounds are commonly affected. So if you look at the wound on the right, the edges separate it, and that is an example of dehiscence. Evisceration is the separation of the wound along with the protrusion of abdominal organs. Coughing, vomiting, and abdominal distension places stress on the wounds, and that can cause evisceration. Dehiscence and evisceration are medical emergencies. The RN will cover the wound with large sterile dressings that are saturated in saline. This picture here is evisceration, so you can see the intestines protruding from the separated wound. Drainage must leave the wound for healing. Trapped drainage may cause swelling of the underlying tissues. The wound may heal at skin level, but the underlying tissues won't close, and infections and complications can occur. So there's a couple ways that drainage is described. First, we have serous drainage, which is clear, watery fluid. Sanguineous drainage is bloody drainage. Serosanguineous drainage is thin, watery drainage that is blood-tinged. And then purulent drainage is thick, green, yellow, or brown drainage. Purulent drainage is usually indicative of infection. So here are some pictures. In picture A is serous drainage. B is sanguineous. C is serosanguineous. And D is purulent. When large amounts of drainage are expected, the doctor will insert a drain. There's a Penrose drain, which is a rubber tube that opens and drains onto a dressing. And then there are drains called Hemovacs and Jackson-Pratt's, or JP drains. They are closed drainage systems that prevent microbes from entering the wound. So this here is a picture of a Penrose drain. And then these pictures, in the one on the left of the slide, you can see the JP or Jackson-Pratt drain. And then next to it is a picture of a Penrose drain. And then on the right side, you can see it's a little bit better picture of the JP drain. This is a Hemovac. So a couple types of dressings. You have tape, which can be adhesive, paper, plastic, cloth, or elastic. Adhesive tape sticks well. However, some problems can occur when adhesives are used. They can be hard to remove. They can irritate the skin. It can cause skin tears and abrasions when removing. A lot of people are allergic to adhesive tapes. Paper, plastic, and cloth tapes usually do not cause allergic reactions. And then elastic tape is used when a body part needs to move. Montgomery straps, that's what's in the picture on the slide, are used for large dressings and frequent dressing changes. A Montgomery strap has a tape strip and cloth tie. With the dressing in place, the tape strips are placed on both sides of the dressing. Then the straps are secured over the dressing. The straps are undone for dressing changes. The tape strips stay in place. They're only removed if soiled. Montgomery straps protect the skin from frequent tape application and removal. These are just some pictures of common surgical dressings. You'll have different size of gauze. In the middle picture, it looks like an ABD pad, which is like a larger kind of dressing. You might have gauze rolls or a gel forming dressing. It just depends on what is ordered.